Welcome, everyone. My name is Stacy Rutland, and you are here in the last keynote of our second day of the 19th annual NABIG conference. This is, as you can see on the screen, keynote Pilots, Data, and the Drive Towards Cash Policies, which is going to be a very exciting and awesome conversation. I think I've been able to participate in a lot of different sessions over the last 24 hours, and almost every single one, some of the topics that we're going to cover today in this get brought up related to, the power of data, what's actually happening on the ground with pilots and with direct cash policies. How do we build on that? How do we think about like the larger vision? All of those things that I know we're going to have an opportunity to dig deeper into here together, which is very exciting. So I'm going to do a little bit of housekeeping before we bring everybody up on the stage and dive into the details. One is, as you can see along the bottom of the screen, you have two kind of key features that are available to you. You can do Q&A, so that's and you can do chat. Anything that you want to just be commenting on and supporting ideas that are being discussed, that should go in the chat. Anything that you want to ask specifically to the panelists, make sure that goes in the Q&A, so your questions, when they land in the chat, they kind of get lost because they, a lot of the time just move pretty quickly. The Q&A from the audience will happen around the 1 hour mark. We're going to try to keep a solid, 20 or 30 minutes into that more loose conversation that can be guided by the things that you all that are watching are most interested and curious about. So put them in there, and then we'll get to as many of them as we can. Hopefully, I am sure that many of the questions that get asked early on will just naturally get answered by the amazing panelists that we have here today. So with no further ado, let's just get into it, because that's what we're all here for, is to actually hear from some of these amazing speakers, amazing researchers, and really experts in the space of data, and data specifically around direct cash transfers. So let's have everybody come up and join me on the stage, and I'm going to start introducing everyone. So first, I'm going to introduce Amy Castro Baker, and can you wave your hand, Amy? Okay, there's two on that screen, so I want to make sure they know who's who. So Amy has her PhD, her MSW. She's an assistant professor at the School of Social Policy and Practice at the University of Pennsylvania. She's also co-founder of the Center for Guaranteed Income Research at Penn and co-principal investigator on the Stockton Economic Empowerment Demonstration, SEED, as we all, probably many in this community call it and know it well. And obviously SEED was one of the key guaranteed income pilots that really kicked off this current surge that we find ourselves in. So lovely to have you here, Amy. Thank you so much. Stacia Martins-West is sitting right next to Amy. She's an assistant professor at the University of Tennessee College of Social Work, and the co-founder as well, and director of the Center for Guaranteed Income Research at the University of Pennsylvania. She's also the co-principal investigator of SEED. Her research focuses on universal basic income, unconditional cash transfers, women's poverty and wealth inequality, and the affordable housing crisis. Her work has been published in leading social science journals, including the Journal of Society for Social Work and Research, Social Science and Medicine, the Journal of Family and Economic Issues, and Gerontologist. The Gerontologist, I hope I pronounced that right, okay, and is regularly featured in major national media outlets. Welcome, Amy and Stacia, so happy to have you. Adam Roseman is founder and CEO of Steady. As the CEO of Steady, Adam is a leading advocate and thought leader for hourly, 1099, and mixed earners. Steady's platform removes barriers to earn through the delivery of its income intelligence and helps its over 3 million members increase their income by an average of over $5,500 per year, and also leverages its income intelligence for the purposes of automating the operation and impact measurement of UBI and cash grant programs. So that's a lot of language, but I think what's really like at the core of that is Steady is helping actually distribute pilots, the funding of pilots to people on the ground, which is fantastic. During the pandemic, Steady delivered more than $4 million in emergency cash grants to their members to address significant drops in income. They were able to see who was having those drops and really try to fill those gaps very quickly and immediately. And they are the distribution partner for several guaranteed income pilots right now that are currently running. So, so excited to have your perspective, Adam. Evelyn Forget is a professor of economics and community health sciences at the University of Manitoba in Winnipeg. Her research examines the health and social implications of poverty and inequality, and she's often called upon by governments, First Nations, and international organizations to advise on poverty, inequality, health, and social outcomes. Her most recent books are Basic Income for Canadians, from the COVID-19 emergency to financial security for all, and with Hannah Alsar, you can correct me on that pronunciation if you like, Radical Trust, Basic Income for Complicated Lives, which is coming out in July, which is very exciting. Thank you so much, Evelyn, for being here. And then last but absolutely not least, Sarah Cowan is a social demographer with expertise in American fertility, social networks, and survey methodology. These days, she's also doing a lot of work on a universal basic income. She earned her PhD in sociology and demography at UC Berkeley and completed a Robert Wood Johnson Health and Society postdoctoral fellowship at Columbia prior to beginning her work at NYU. She is founder and director of the newly established Cash Transfer Lab at NYU, which is very exciting. They're examining the universal cash transfer programs, such as the Alaska Dividend that's been in place since 1982. Her published work has two overlapping subject areas: abortion in the United States and people keeping secrets from each other. Oh boy, I want to just dive right into all of that. Her current work expands from abortion to other areas of reproductive health as well. So thank you for being here, Sarah, as well. And thank you, amazing panelists, for taking some time here to really continue opportunities for our community to dig deep into the space of data and the kind of influence it can have as we start to hopefully get closer and closer to policy. So at the top here, let's really focus. I'd love to just give people an opportunity to talk a little bit more about the work, the specific work that you're doing in the space as a level set and kind of context set. Some of the pilots that we've been looking at have a longer history than others, and so I thought maybe we should do this chronologically just to see how things have built a little bit as we go through. So I thought we would start with Sarah and hear a little bit more about the work that you've been doing as you're looking into the Alaska Dividend. What are some of the most important things that you're learning that could help really build the case for a federal basic income program?
Great. Thank you so much for having me. And I'm thrilled to be here and share this part of the internet with so many people whose work I admire. So it's just really, it's a wonderful thing to be together. So I am going to speak to you in my role as the founder and executive director of the Cash Transfer Lab at New York University. Our mission is to build an evidence base regarding cash transfer policies in the United States. And our initial focus is on a longstanding cash transfer policy in Alaska. So I'm going to give you a little bit of background on the Alaska case, and then I'm going to be telling you about the work that we have and are continuing to do on it. So since 1982, Alaska has paid a cash transfer to every single resident in the state, which is a lot of people. About 700,000 people live in Alaska. So this is a cash payment that is truly universal, and it is substantial in size, though it falls far short of the basic, what we would think of as a basic income. And the work that we are doing in Alaska, we see very much as complementary to the pilots. And there are some real advantages to the pilots, which I'm sure you've become familiar with over the course of the conference. The advantages of studying the Alaska case is, one, that it's really long-term. It's been happening since 1982. The second is that it includes rural populations. Most, if not all, of the pilots are in urban areas. And so this provides a greater diversity of people to study. And then the third is, because it is such a large population, we can look at the effects of this money at populations that would be too small to really detect any differences or effects in the pilots, which at the most would be, we can 1,000 people, let's say. And maybe there are more, but we have the advantage that with 700,000 people, we can look at small populations, or we can look at people with regard to multiple identities. So we can look, at Indigenous women who live in rural areas, type of thing. So those are the advantages, and there are plenty of disadvantages, but I'd rather not take up your time now outlining those. I imagine they'll come up in the Q&A, and I hope that they do. So if you are familiar with this program, you've probably heard about it as oil money. And that is something of a misunderstanding. The better way to think about it is as a mutual fund in which every Alaskan resident owns one share. And the principle for that money came from mineral extraction, primarily oil, but at this juncture, it's really detached from oil, and you can just think about it as a mutual fund. But the reason why I bring that up is because while you could potentially think about this as a tax, it's a little bit convoluted to do that. And by and large, Alaskans do not. It's not as obvious a redistribution of resources as basic income and guaranteed income proposals. And Alaskans do not think about it as anything affiliated with universal basic income. And in fact, many of them have quite a bit of hostility to that linkage. They very much think about it as an ownership share. That's the language that most Alaskans use. And in about 2 minutes, that'll become relevant. And I promise I won't take up too much more of your time. But I bring that up just to underscore that this case is best to understand the effects of the influx of cash to families and individuals, rather than thinking about what work we could do to bring a policy about. So skeptics have some central questions, and you may dislike these questions. You can reasonably argue that these questions are rooted in racism and rooted in a moralistic and individualistic understanding of poverty. And that is a totally fair argument. They are nonetheless important questions because so many people have them. So they are: one, does cash transfers reduce working? Evidence in Alaska suggests no. Two, does it increase childbearing? Evidence suggests yes, to some extent in the short term, and particularly among disadvantaged populations. Three, is it spent on temptation goods like alcohol? We don't know yet. The Cash Transfer Lab is answering those questions, but we are also broadening the questions. Those questions, the most generous way to describe them is that the answers to those questions are never inspirational. Let's put it that way. So we think that by broadening the questions, we can answer important things, but also increase enthusiasm. So for instance, sure, let's ask the question, does it reduce working? But then let's ask a secondary question. So if it does reduce working, well, what are people spending their time doing instead? There are a lot of different answers to that, potential answers to that question. And we, and policymakers might feel differently about the policies depending on the answers to those questions. Second, with regard to childbearing, we at the lab adopt what is called a reproductive justice framework, in which we interpret the evidence that suggests that there are disadvantaged populations in Alaska who have more babies when they get money suggests to us that there's an economic barrier to having children, and that that's a reduction of individual autonomy. With regard to alcohol, like I said, we don't know the answer, but I can guarantee you that there is somebody in Alaska who gets the money and spends it on alcohol. And so the question in my mind is not, do people do it? But what is the extent to which people do it? And then it becomes a normative question for communities to decide what level of temptation good consumption matters to us, weighing against the positive things that come from this cash. And I'd also like to just underscore an element here about deservingness, because we don't ask whether or not people spend their wages on alcohol. This is a question we ask about redistribution of money. And this is where I want to underline that the Alaskans don't think about this as redistribution. And so, you know, a founder, like a thought leader, a framer of this policy said to me, he's 95 years old, and he said, I don't care if they, you know, piss it all away on alcohol. I don't care if they die of alcohol poisoning. It's their money. They can do with it what they want. I don't think we could ever imagine a thought leader in terms of a redistribution saying something along those lines. But also, we're also focused on other questions. Questions like, does it diminish inequality? We find in one study that it equalizes parental investments in children. We're interested in whether or not people use this money to invest in small businesses, to make capital improvements, or to start small businesses. Does it protect people against eviction and foreclosure? Does it help them reach their educational dreams? Does it improve their health? So we're gonna absolutely tackle those questions that the skeptics have. But my vision for the lab is far broader than that. And I am so thrilled to hear from the other people on the panel, because part of my vision has been inspired by them. So I'm going to pass the baton.
Awesome. Well, there is so much in there that I'm so excited we have a time to get into that, but we're gonna pause for a moment before we do, just to make sure that everybody's has a chance to talk about some of the work that they've been doing, because we might be able to really start to see overlaps or kind of growth in some of the ideas and results that come out of all of this amazing work that's been happening. So I want to now kind of pass it over to Evelyn, if we're doing this thinking about the things that have happened in what we might call like the first phase of the pilots back in the the 70s and 80s. You've been spending a lot of time looking specifically at some of the work in Canada, and I'd love for you to tell us a little bit more about what the implementation actually looked like in a couple of these different spaces, or you can focus on one if there's one that you feel like is a really interesting one to sink our teeth into, and what are some interesting findings that have come out of that pilot that we might want to carry forward with us.
Thank you. I'm really happy to see this proliferation of small-scale pilots happening all over the US. I think it shows an incredible amount of enthusiasm for cash transfers, and I think that's a really wonderful thing. And I'm particularly happy because what I see is a transition away from the large-scale government-led experiments of the past, the sort of things that we've done quite a lot in Canada. We've got a bit of a history in this country with big government-led experiments, and it's left a bit of a bitter taste, and I think we need to acknowledge that. We've had two large-scale basic income experiments in Canada. There was the Manitoba Income Project in the 1970s. It produced reams and reams of data. The entire experiment lasted 5 years. Thousands of people received a basic income for a period of 3 years. But the data was produced after governments changed and when governments no longer had any interest at all in changing policy. The other experiment is, of course, one you've heard a lot about in various sessions at this conference, and that's the Ontario Basic Income Guarantee experiment. An incredible amount of enthusiasm, again, thousands of people involved, a government-sponsored project, canceled prematurely as soon as the provincial government changed. So MINCOM ran its course. The Ontario experiment didn't. Neither one of them translated into policy. Both of these projects, I think, produced interesting results insofar as their formats allowed and the length of time allowed. But I think we also have to recognize some of the dangers about what happens next. MINCOM itself was established in the 1970s to answer one simple question, very similar to the question that Sarah began with, and that is, how would a basic income affect the number of hours worked? What would be the impact on work effort? So thousands of people received money over a period of 3 years. Boxes of data were collected. The project ended, and governments refused to come up with the money to analyze the data that was collected. So there were boxes and boxes and boxes full of paper sitting in archives for years. About a decade later, two economists, Wayne Simpson, Derek Hum, managed to extract the data from one of the sites and to answer the question. And big surprise, I mean, people who were working before this experiment came along continued to work after the experiment came along. It really had very little impact, except on two groups of people. New mothers who could suddenly buy themselves longer parental leaves when they gave birth, and young single men. And that seemed, in fact, to feed a lot of the stereotypes that were out there. Young single men were suddenly not working. They were working a lot less than when the experiment came along. And it sat there with that finding for about 20 years. And it really wasn't until, maybe 15 years ago, when I was able to go back and to uncover some of the data and put a slightly different interpretation on what was happening. It turned out that the young single men were 15 to 24-year-olds. And the number of hours worked declined because people were staying in high school longer. So there was a nice little increase in high school completion rates. I was able to mine that data and to get some other results out of it, health results. In particular, we saw all-cause hospitalization decline pretty substantially among recipients relative to a matched control. But, on the whole, you've got to ask yourself whether the amount of money that went into this big, large-scale experiment was really worth the rather obvious, I think, outcomes at the end of the day. The Ontario Basic Income Guarantee experiment caught an incredible amount of enthusiasm when it was put in place. The people who designed the experiment were careful to think about what was going to happen at the end of the experiment, how you were going to transition people off that experiment at the end. Government changed and all of that went out the window, and the experiment ended in a particularly brutal way. And so I think that's something that we need to think about again. So I guess when I look at this, on the one hand, I see all of these pilots associated with a great deal of enthusiasm. And, and as a data person, I think this is great. I'd love to get my hands on some of the data to see what the consequences are. But I think the shift towards small scale policies, I think is something, or small scale projects is definitely beneficial and definitely a better way of approaching this than the large government run projects. And I think I'll stop there.
Excellent. I love that you brought this up, because it almost, at least in the US, that almost feels like the opposite perspective that is often discussed. There's been like concern about pilots and demonstrations being too small and what happens with the data, which we're going to get to Amy and Stacia and some of the work that they've been doing around being able to unify data. So we have larger data sets, but still being able to do, make sure that things like there's adequate funding to actually fulfill the obligation and the goal of the pilots themselves. So I think there's a lot of really great stuff there to unpack. And
can I just add one more thing if I can? When I say I'm enthusiastic about the move towards small scale pilots, I think it's because the nature of the questions they can answer and the nature of the kind of thing they could do is quite different. Thanks.
Awesome. Thank you for clarifying, Hort. That's great. So I think next, the next person to chat with for a moment, maybe Adam, because I know that that I think Amy and Stacia, the work that you guys are doing might kind of bring a lot of the different topics kind of together. Adam, so STEADY's been distributing millions in one-time grants that you talked about at the top, and also you've been involved in the distribution for pilots. Some of those were very kind of small, shorter term pilots, so that they might be complete at this stage. And I know that some of your pilots are in the early stages, and so you might not have results to speak of for those. But if we're thinking about the cash grants or some of those smaller pilots, what are some of the things that you have been learning from this amazing, huge data set that you're able to collect?
Yeah, no, I appreciate that, Stacy. And I think I'll also add to that, the analysis that we've been conducting across roughly 700,000 of our 3 million workers who have been on some form of unemployment benefits during the CARES Act as well, right? Because we have visibility into the impact of those benefits, just given that part of the experience with Steady is that individuals link their deposit accounts to our platform. So we have direct visibility into the financial activity and financial health of each of those individuals. So, I think as a starting point, I'm incredibly pleased to have the chance to work with all of you who have laid the groundwork for where we're at today. I'm thankful that our platform can provide some support in terms of effectively empowering and hopefully scaling these endeavors in a way that, whether it's private sector driven, public sector driven, I'm not in a position to opine like others on in this conversation, but, irrespective, I think there needs to be a way to create impact measurement at scale, and to do so without resources that become, blockers from the standpoint of enabling, a project set to scale. So, from our perspective, I think what's been most critical is to, build in an automation ecosystem in which, we can not only have the ability, and I'll get to your question, but not to only have the ability to look at those individuals who are receiving the monies, but have a large enough pool of workers, 3 million of which, as I mentioned, to create control groups that are also at scale, right, to directly measure the control versus those who are receiving the cash. So, we've done that pretty significantly during the course of the last 18 months. And what we found is a pretty consistent outcome. And, listen, we obtain video testimonials, but we don't have the type of interaction that, Sarah and Amy and Stacia and Evelyn have in terms of, talking with these folks day to day. All we can see is the data in the bank account. So things like, are they spending on things like alcohol? We could probably figure that out a bit, although most of it will be coupled with just a general retail store spend. But what we can tell you is what's it done to their overall financial health, right, in terms of receiving cash. And what we've seen consistently initially with our cash grant programs during COVID, in which there were on an average of about $800 in one-time grants provided to individuals who had been heavily impacted by COVID from an income perspective. So we basically built groups of individuals in industries that had been heavily hit, such as rideshare, hospitality, and others. And at the time of the income loss, quickly got money into their accounts, right? We identified the income loss, and typically within a day or days after the pay period had been missed, we put money into their accounts, averaging about $800. And we looked at that versus groups across the country in the same industries that were, keeping in mind, these are industries that if individuals were going back to work, they weren't going back to work in those industries during that time, right? They had to find other work. For those that received the cash grants, it was incredibly heartening, right? I think, we saw on average about 13% underperformance of the group of individuals who were cash grant recipients pre-receipt of the $800. And post-receipt of that one-time $800, the earned income of those individuals outperformed those that were in the control group by 28% in the following 3 months, right? So going from 13% underperformance to 28% overperformance, based on the ability of those individuals to have the ability to focus on self-empowerment and focus on getting themselves back to work, while others were needing to focus on, how do I pay the bills today? How do I put food on the table? How do I make the rent check at the end of the week? Some of those massive stressors and massive time sets were alleviated to enable people to get back to work, right? So, we saw the same thing with our analysis of individuals who had received unemployment benefits, right? And looking at those who received them quickly versus those that didn't. And, pretty consistent, unfortunately, during the course of COVID, of those who were W-2 workers receiving their monies much quicker than those who were PUA and MUC recipients who were alternative workers, right? So 1099 or mixed earners. And, again, those who received their money, though, in general, substantially outperformed those that had to wait, right? Even after those individuals received perhaps their funds 3 to 6 months later in certain instances, and may have received very large one-time accrued payments, they still didn't find themselves back to work quickly, right? Because I think the hole that it put them in. So that kind of takes us to the UBI endeavors, and that what we're pleased to be able to do now, and I think in particular supporting Amy and Stacia's efforts, is to leverage this automation to create an ecosystem that can empower cities to A, distribute cash, B, in certain instances, if they choose, identify cohorts and control groups, and then I think C, produce a set of financial data that can be handed off to those who know what to do with it, from the standpoint of analyzing it and hopefully driving positive change off the back of what we're seeing. So I'll stop there, but just very, very glad to be here, and very glad to be involved.
Awesome. Thank you, Adam. I loved how much is coming up here around like pipelines and infrastructure, and and the critical nature, the critical importance of that. Boxes and boxes of data being in somewhere in archives versus having something in place that can collect that and immediately transfer it to the people who, like Evelyn, if somebody just handed those boxes over to Evelyn decades ago, we could have actually been able to answer the follow-up questions of like, oh, men aren't working, young men aren't working, what are they doing, kind of things that really get to not just the what, but the why or how, that's so critical for us in understanding the implications and thinking about kind of next pieces. So so really cool to hear all of that coming together here. Amy and Stacia, let's talk a little bit with you guys, or hear a little bit more from you around what's happening. Maybe we start with SEED, because you both were so deeply involved in that. And I know just a few months ago, the results of the first year of the SEED program came out. Do you want to maybe start there in what you guys have seen in those results? And then we can get deeper into some of these other questions.
Sure, I'm happy to. First of all, this is amazing, y'all. I am on a panel with Evelyn Forget. Oh my gosh, at Sarah Cowan, like I'm dying. This is so cool.
Adam's right there.
Adam, you're great.
He can hear what we're saying.
Okay. Truly, I'm fangirling. Okay, so yeah, I think we can talk a little bit about SEED and what we found, and then also talk about why we're doing this work, why we're running so many pilots, and kind of like what is the ultimate goal here. So of course, SEED ran for 2 years. There were 125 people in the treatment group receiving $500 a month. It was actually only supposed to be for 18 months, but we had a philanthropist come through in the midst of the pandemic and be able to provide the additional 6 months of the cash transfer. So we had 200 individuals in the control group. And what we were really looking at was 3 key research questions. So first, knowing that income volatility is a growing issue, not only for lower income populations, but for the dog, it's making noise, for higher income populations increasingly. We wanted to know how guaranteed income could impact income volatility. And what we found is in the treatment group, they experienced month over month income volatility at about 46%, compared to the control group that were experiencing month over month income volatility at about 67%, which is quite high. In both groups, we know from some prior work that you want income volatility, you don't want it, but around 35% is somewhat tolerable for households. So that was our first key finding. And, in some cases you kind of say like, oh, well, you gave people more money that they could count on. So of course, income volatility is going to go down, but we use a mixed methods approach. And so there, the why and how did this work is also very important.
Yeah, so I mean, essentially what we saw, a lot of things, but I'll pick out just one to talk about with this particular component, is that smoothing of that income volatility, but not only saw changes in well-being, which Stacia will cover in just a minute, but also that families really creatively patched holes in the safety net and really covered over unpaid care work and other kind of needs that were happening, this really kind of a pooling effect. And so part of the challenge here with a lot of the work that we're doing from Mixed Methods perspective is saying, how do people actually live? And it's in networks, right? And so what we really saw was that income volatility being smooth went well beyond that initial research participant and actually stabilized entire networks with things like food insecurity and needing to borrow less money from family and friends.
Yeah, so that's kind of a lot of what we know from like 50 years of social science, right? Whenever you give lower income folks money, we look at the spending data as well, they spend it on basic needs, right? And so when something like an EITC payment comes in or something like guaranteed income arrives, what we see is folks kind of pooling across networks, stocking up on household goods, making sure that those basic needs are met. And so what we hypothesized based upon Mullainathan and Shafir is that what would happen after that stabilization is that there's some change in overall mental health and well-being, and that is in fact what we saw. So what we saw over the first year, I should say these are just first year findings, is that individuals had lower rates of reported anxiety and depression based on the Kessler-10, which is an instrument that we've probably all taken at some point or another in our lives and not known it. But what we saw was that the control group really hovered in this space of extreme anxiety and depression simply because of their precarious financial situation. And over time, you see people in the treatment condition gradually moving toward a place of mental wellness. So what does that do in terms of being able to think about the future and plan for the future?
Yeah, I mean, essentially, in short, kind of that financial scarcity generated time scarcity, and that spilled over not only into mental health and well-being, but time for relationships, risk-taking, which we'll cover in just a moment. But really, one thing we forgot to say at the outset was, on the one hand, yes. So as a trained social worker and somebody who's done social science for more than a minute, right? We weren't surprised if you smooth income volatility, you're going to see changes in anxiety and depression. That wasn't a surprise. But what was a surprise was how small an amount of money could actually generate that level of shift across the network. So I'll be honest, I expected to see those types of changes in the actual recipient, but seeing how far that money actually went, I mean, I know people are savvy, right? like we know this in our bones, especially if you've worked in the field or if you've experienced poverty. But thinking about how far $500 could go in a state like California, I think really shows me that my imagination is too small most of the time when I'm thinking about innovation.
Yeah. So the third thing that we asked was really around, how does this open up agency and kind of control over one's own future, right? Now that you have food on the table, you're stocked up, you have reductions in stress and anxiety. Does that then open up possibilities for you to think about a different future for yourself or to just show up in your life, right? In a way that maybe you haven't before. So one of the ways that, and I will say only one of the ways that we looked at that was looking at employment changes. So what we saw in the treatment condition was a 12 percentage point increase in employment just over 1 year. So from 28% to 40%. And then in the control condition, only a 5 percentage point increase in employment over the first year. And so thinking about this, it makes a lot of sense, right? Finally, you have the opportunity to consider, and the confidence really to consider, I'm going to take this internship, right? I can take this risk to take time off work to interview for something new. I can afford the clothes to go to this interview. Those sorts of things we often don't think about, right? Those of us that are higher income, that those are true trade-offs that lower income people have to take in order to move up the economic ladder.
Yeah, and so there's sort of two ways that we saw that employment change. The ways that the money interacted with it. So first was removing material barriers. So obvious things like being able to take off a shift at work to actually apply for the job, right? So the example I use oftentimes is saying, my Penn grads often apply for 30 or 40 positions before they actually land a job. And they're Penn grads, right? So if you're living at or below the poverty line, you literally cannot take a day out of work to try and apply for another position. So we saw that $500 really removed that material barrier in terms of time. Then of course, as Stacia was mentioning, also being able to engage in internships. So in many cases, we found people knew they were eligible for steadier employment, full-time employment that was healthier, but they literally could not take the step to do it because it meant risking being evicted, risking missing a bill, things of that nature. And the second piece was really, some people would say cognitive capacity. I would really say, describe it as risk taking, right? So the way that recipients described it to us over and over again was, I can take so much risk. It's just the ability to calm, right? Lower the anxiety, lower the depression, breathe, and actually imagine an alternative pathway, and then feeling confident enough to actually jump and take a risk that may or may not work out.
Yeah, so the last thing we want to talk about is kind of a new term that we've found studying guaranteed income, which is freedom from forced vulnerability. And so part of what we hear a lot is romanticization of poverty, right? That it's so great to be interdependent, right? When, part of this whole American ethos is independence, whether you agree with that or not, it is what it is. And so we started seeing these patterns of being free from forced vulnerability. Want to talk more about that?
Yeah, so, in the words of one recipient, they said, poverty means lack of choice. You're forced in ways you don't want to be. And so what we saw was that just that small amount of money removed people from systems that invited surveillance and relationships that in some cases were toxic or were not necessarily by choice because people had no other way to get by. And so on the one hand, relationships were meaningful and not sort of like wanting to characterize people's relationships or familial ties. But it's one thing to choose who you're going to rely on. It's another thing to be forced to be vulnerable. So what we saw was that the money really disrupted this cycle in small ways to where people were able to move from being forced to be vulnerable to systems and to relationships that they might not want to be. Like, I might not want to choose this childcare provider. I might want to choose this other one, right? To choosing to be vulnerable or choosing to be interdependent, which is extremely different. Those are two very different things. And we're excited as we're kind of moving forward with these other pilots that we're working on to explore that further.
Yeah. So there are a couple of implications that we always like to mention of this work. First of all, and I think we all know this, is that cash is not the be all end all that's going to solve all social problems. And that when implementing a guaranteed income program, you are going to run up against a number of different social problems that you cannot touch, right? Like the cost of childcare and the cost of housing, the difficulty of implementing alongside an existing safety net. So that to say, there is much more work to be done. So why are we scaling up and scaling out all of these pilots when many of us, firmly believe cash works, right? Let's just scale it up and that'll be that. Do you want to talk a little bit about that, the federalism piece?
Yeah. So, I mean, before I say that, we should tell them where we're at because a lot of the pilots, they're not public yet.
They're secret.
They are secret.
No secret pilots.
Secret. That's for Dr. Cowan.
Sorry.
No, so I will say, by the end of this year, we will, within the Center for Guaranteed Income Research, we will have launched, I believe it's 26 distinct experiments across the US that in some way, shape or form are providing unconditional cash. Most notably, we're actually in the midst of launching the first clinical trial with over 2,000 patients who are experiencing cancer and looking at how does that overlap with financial toxicity. And the reason being, we don't want to pilot for pilot's sake. Like, what's the point, right? Like, where are you going, right? So we're contacted by a lot of very well-meaning policymakers and nonprofits who are, this sounds great. It just sounds like a really exciting thing. Maybe this will get me reelected, right? But we don't want to engage in that. And so really have some broader questions. First, we don't know yet who guaranteed income really works for and how, right? And I can tell you a lot about guaranteed income in California. That means very little for our other research sites. So knowing how cost of living is going to impact how well people are able to stretch the money or not, knowing what populations are or are not locked out. So if we look at the CARES Act, for instance, and who was locked out of that particular stimulus payment in the US, we learn a lot about how we could bake new forms of inequality into this turn in the safety net. Because if we waved a wand tomorrow and we passed basic income in the United States on a universal scale, if we were mirroring the CARES Act, we would literally be baking in new forms of inequality that are going to continue to show up for decades. So when we think about these pilots that we're running across the US, one is sort of really leaning really deeply into implementation and trying to figure out how do we get these systems to work together? How does guaranteed income work in the context of a community that may or may not have safe banking, right? How do people engage with those particular local markets? And then second, I just want to circle back to something Dr. Forche said, which is thinking about top down versus bottom up. So right now in the US, it's no surprise that we're kind of in a moment of political divisiveness, and there's not a lot of political palatability for things coming from the top, beyond the child tax credit, which is going to hit roughly 90% of families with kids. And so for that reason, if you want to create buy-in and narrative change on a large scale where we want to jump forward in a progressive way, we know that it has to come from a bottom-up federalist approach. So if we take, for instance, marriage rights and marriage equality in the US, that started first, not because the federal government decided to extend rights to queer people. It started first because Governor Newsom, then Mayor Newsom, was pushing from the bottom up, and we saw those bottom tiers of government building community support, building narrative change, and then eventually scaling up to the federal government. So, I mean, it's hard to say how that will play out here in the US, but from a discourse analysis perspective, I think that's likely where we're headed. I don't know what else you wanted to add to that.
No, I think that's good. I think we've talked enough.
Yeah, we've said enough words.
Well, first of all, that was like watching a dance of two very, very like two partners who have worked together for a long time, and like the handoffs, the everything. It was lovely to see. I think I've seen you guys present the seed findings a couple of times, and every time I feel like it gets better. So thank you for making it fun. Sometimes it's hard in the data world to make it fun and interesting, and you guys nailed it for sure. But I think where you've ended is actually a really great place for us to spend a little bit of time, which is in this idea of really, when we think about like making the case for guaranteed income, and are there, benefits to pilots, and what are the different kinds of benefits to staying in the pilot space for a while. I would love to just hear from other people on the panel to go a little bit deeper, because I think this came up in multiple people's initial kind of conversations. So like, let's continue there for a little bit. What are some other ideas, or adding to the ideas of Amy and Stacia around like why it's important that we continue the work in pilots, and things that we can accomplish specifically in pilots that are going to be so important for where we want to go at kind of a federal level. Evelyn, do you have any thoughts around that? No. So one thing that I think that comes to mind for me are some of the things that we've talked around, narrative change, and the ability actually to start thinking about, as more information comes out, and when we think about each of these waves of pilots coming to kind of completion, where you can actually do more analysis of the data, is another opportunity to dig deeper into reinforcing narrative change, right? And so how have you guys, as you've been thinking about the results of this, of any of the work that you're doing, like what is that role of narrative change, using the data to really address some of these pieces?
Oh, I mean, there's so much, right? So first I'll say, the shame and blame that's attached with failures within capitalism is like, we can't talk about this without talking about that, right? And so if we're not dismantling the myth of the welfare queen, if we're not challenging these shame and blame narratives around poverty, around deservedness, they're just going to get transferred off of the social safety net, not to basic income, right? So, right, we can generate all the data and policy change we want, but we know the durability of social constructions. And so we have a responsibility from my perspective, as social scientists, to say, how do we push on both at the same time? And that means different things for different research teams. But I think at a bare minimum, regardless of where you sit within the research landscape, you have to be engaging with that question. So you might not necessarily be, building out data dashboards or engaging in, discourse analysis, things of that nature. But we ought to be thinking about, how are we presenting these findings? How are they going to be seen by the public? How are we partnering with communities to dismantle some of these narratives? And what is it that people actually want to know? What do they believe those questions ought to be? And so to me, we can't really talk about this without talking about narrative change, regardless of like the type of science that we're conducting.
I'll add a little bit to that and say, whenever we were thinking about this in Stockton, we thought about narrative change alongside community. So we had two community groups that we met with and still helped us with the final report. We're authors of it. So one member or one group that is public housing residents, and another that are high school students. And so whenever we brought the data to them, kind of the preliminary data, they were like, we want to see the spending data on the dashboard.
And we weren't going to release it.
I was like, oh, hell no, that sounds awful. Like, we should definitely not do that. And these lower income moms were like, no, you have to that's what everybody wants to see, put it out there. In our position as researchers, right, there's paternalism and there's power built into this, right? But these folks were saying, like, no, we know how low income women spend their money, right? Like, you can put that data out there. We don't have anything to So I think it's, change the narrator, and that's how you change the narrative. Let them speak and make the decisions.
Adam, I know you're going to have to jump in just a little bit, so I wanted to make sure that we had a chance to go a little bit deeper into. I know you mentioned at the beginning that you have some testimonials and some of the stories that have come out of the cash grants that you guys were able to administer to your members. Are there other things related to kind of surprises in the data, or things that you think are really important around this idea of the kind of the narrative shift, or like rethinking about or repositioning what is actually happening on the ground with people, and the role that cash plays that's important for us to know and think about?
Yeah, I mean, we at this point have, I think we have video journals from over 10,000 of the participants or recipients of the cash grant program. So, I cannot say I've watched all of them, but I've watched as many as I can. And I learn a lot, right? In that, I think first off, just the sheer diversity of individuals, I think beyond just what the expectation would be, but just the number of, whether it be those who may be traditionally associated as those that, may be more prone to income loss, those that are service industry workers, right? For example, just seeing, again, the sheer impact of COVID, and the number of middle class workers that we've seen fall out of the middle class, right, during the course of COVID, and that our platform was set up to support those that had income levels below the middle class, and that's where we're most effective. But unfortunately, that target market substantially increased. I think additionally, just hearing I think the emotions of the individuals who received the cash, and generally we would have them leave those testimonials right after, right? So they'd receive the cash. We knew we just sent them the money digitally, and then they'd receive a push notification on their mobile device, right, with a wire, almost kind of like the, maybe I'm dating myself, but the old Publishers Clearinghouse sweepstakes, right? It's like they show up at the door with a check, and how do you feel? So I think there was a lot of realism in terms of the feedback that we received. And I have to tell you, it's folks from I think all elements of the spectrum from a political perspective, right? So those who you would expect would perhaps be in areas that may not be as progressive from the standpoint of cash programs, really just showing how incredibly helpful this was for them in almost all instances. I think the other thing that's interesting to hear is just, I heard Sarah mentioned earlier, I heard Amy and Stacia talk a little bit about just the recipients themselves even kind of viewing this is, Sarah's comment of the recipients in Alaska, like not wanting this to be associated with the universal basic income. It's really interesting for me to hear just how the framing of it created that. I think that perception of nativity, we operate entirely digitally, right? And so when people receive prompts within our app, right, it's not universal basic income that's discussed. It's, do you need a safety net, right? It's like if you have a challenge in your life, right, there's a safety net that's here for you. So that, I guess that visceral response that's been so heavily politicized, at least through what we've seen through digital channels, that, it's not something I would have never even thought about, right, prior to this discussion right now, right? Because it's just not something that we've seen at all, because I think the messaging is so different, and the messaging is also digital. So I don't know if there's just a general perception difference if someone's calling you on the phone, or if you're having to interact with someone, versus kind of that blind nature of, being able to be, I'm not equating the two, but right on the internet, a little bit blind, right? Whether you're able to be a Twitter troll, or, or speak your, I think your comments on how to, create better change. But it's just really interesting for me to hear that in particular, given that we've not seen that narrative challenge at all.
So I'd love to, thank you so much, Adam. I'm really glad that you guys exist. because a lot of when Income Movement was first forming, it was before the pandemic. It was when the first months of seed were in place, and we had a lot of conversations internally about how do you make sure that you're gathering the kind of data in the right ways that's going to make it so that you can be effective and make the best use of this, which, Evelyn just has such a great can point so perfectly to the problems with how things rolled out with Canada related to that. And so I just think there's something very important about, even though you weren't necessarily building a lot of the pipelines that you were building initially for this, that it's in place and is now there ready to be supporting what we know is just certainly in the last 16 months been so critical. I just want to say before I know you have to jump that I just really appreciate that not only did you create it, but that you're now connecting with all of these amazing people doing the work on the ground to make their jobs easier and better, easier to implement and quicker and all of those things. So thanks. So I'd love to understand, when we were talking about what's come out of the data, out of the research, there's been some focus pretty consistently on work outcomes, like the effect of work. Follow-up questions around well, how are we defining work? What is work actually, when there's decreases in work, what does that actually mean? And then also mental health. I'd love to understand from you all if there's other areas within those two larger umbrellas that you really hope that research is able to go deeper into, or if there's whole other new areas that haven't been effectively focused on yet that you think is really important. And Sarah, for sure, I'd love to hear from you on this.
Yeah, so I daydream all the time about, I might be the geekiest person because I daydream about dependent variables. I daydream about all of the things that we could measure, and discover. And I really want to underscore, I want to underscore everything that's been said earlier, but Dr. Martin West said, to change the narrative, you change the narrator. And I think the first mandate is finding out what are the questions that are most important to the people who are most affected. And then the other, and what I can tell you from, talking to Alaskans is, there's a lot of concern about interpersonal violence. The way Dr. Castro Baker described forced vulnerability, right? So there's a lot of concern about interpersonal violence. They're both, but in both directions, that the money could be spent on alcohol and it could increase interpersonal violence, but also that the money could allow people to leave unhealthy relationships. And we have historical evidence to suggest that it could allow people to leave unhealthy and violent relationships. So that's one avenue. Another is recidivism. So crime in general, and then also recidivism. So many of the people who are left out of the social safety net are people with criminal records. And that is somewhat to the case in Alaska, but less so. So does this cash just give people the leg up so that they don't resort to crime? And there's one, my pet this week is there are a whole bunch of civic engagement measures, things that I would love to measure. And my pet this week is jury duty. Everybody shirks jury duty. Everybody. Not every person, but every population shirks jury duty. And is it plausible that when you receive this money, either because you are now like financially able to do things like take time off of work, or because you feel a connection to your community, because your community is supporting you, like maybe we'd see an increased rates of responding to jury duty. I mean, it's a little far-fetched, but like, wouldn't that be an amazing, positive story? And
better representation.
Yeah, or like voting, you know, voter turnout, all sorts of the civic responsibility types of, you know, matters. And one of the things that I get so excited about in terms of the Alaska work is the capacity to tell community stories. You know, so this not just of individuals serving their community, but also, you know, these network effects and just community-wide changes that can happen when an entire community is better off. I'll stop here. I could go on forever.
Well, Evelyn, I'd love to hear a little bit more of your thoughts on this. You know, when you were talking about your excitement and around the smaller pilots, you said it was really about the quality of data or the kinds of data that you can collect and stuff. And obviously that leads to the results or the questions that you can answer. So what have you been, you know, most hopeful about being able to learn more about?
I've just been scrolling a lot of notes here. I've been listening with a lot of interest over the last little while. Any social scientist can come up with a million questions we'd love to collect data on and answer. And I think that Sarah's monologue just a minute ago was a perfect example of that. I mean, there are a million things that we can measure out there. Why do we want to measure these things? Why is it important, and to whom is it important? And there's been sort of a shift back and forth in the conversation over the last little while about whether we're doing this for the participants in the experiment to build community from the bottom up, to build popular acceptance of the idea of a basic income, whether we're trying to address the critics over here who think that people are just going to, you know, quit working, buy beer and have more babies, or whether we're trying to address policymakers who might be in a position to actually finance this and put it in place. Which is something we haven't talked about with any of these pilots, by the way, where the money's going to come from if it's ever going to be implemented on a permanent basis. And I mean, I think in some sense we need to, when we talk about shifting the narrative, we need to recognize that there are a lot of different narratives out there. And, you know, the kinds of stories you tell to, or you collect from, or you help people construct among participants in an experiment are sometimes very different from the kinds of stories that are kinds of narratives you construct when you're dealing with policymakers, when you're dealing with senators, and you're dealing with members of parliament. And I'm just a little bit confused about what it is you're doing when you're collecting all this data. What is it you have in mind? Why are you focusing on these particular issues? And is it just pure curiosity? I mean, is it just because we're social scientists and it'd be cool to know how people spent their money? Because I'm one of those people who says, well, so what? So what if they spend more money on beer and cigarettes and drugs? So what? It's their money. You know, why are we collecting data on that? Why is that an important thing to know? And will people believe us anyway? If we collect data and say that it's not true, are they going to believe us anyway? I mean, I've been through this so many times. You know, there is so much data out there, for example, in health effects, all kinds of health effects associated with cash transfers. Almost any way you want to spin it, and people simply don't believe it. Or you collect data on employment effects. Well, there's a huge amount of data out there. There's a huge economic literature out there that says if you give people money, and in particular, if you give them unconditional money, there's better matching on the job market and they'll have better job performance. You know, what's the value added of the pilots we're running in order to collect data to show that what we already know is true is actually true and happens? You know, so I mean, I've got a lot of questions about what it is we're doing with these pilots. I mean, I think on the one hand, it's very exciting to collect data and to do things, but what are we doing with it, and where are we going with it, and whose narrative in particular are we trying to change?
I love
so
that.
I'm going to leave it there. And this is
yeah,
just
no, Amy, Stacia, Sarah, do you have thoughts on that? Because it feels very much so about like at the inception of the research, you know, the thinking about the overall kind of strategy approach, like the end goals, where you're trying to get to, what is the roadmap that you're trying to kind of build for, like, and how that informs each step in the process of the data collection, at least, and also obviously even just like who you're targeting and all that kind of stuff. Do you guys, maybe Amy, Stacia, do you have thoughts about, or want to share a little bit about how that has worked for you guys?
Sure. I love to tell this story that one of our funders, one of our largest funders, asked me what effect size moves policy, which is a horrible question to be asked, especially when there are no priors. So that's really where we're coming at this. However, so it's really twofold. One, I don't want to talk about work and temptation goods ever again in my life. I am so sick of talking about that in this very constrained way. What I do want to talk about is really what Dr. Cowan brought up is, you know, how does this relate to care work, right? What level of community tolerance do we have for whatever these temptation goods are? There's a much bigger conversation to be had, but I'm from the Deep South. Even my own family, this is as far as we get. It's just this conversation around work and temptation goods. And that's fine. And I think part of our narrative or narratives should be still tailored to that. Like it or not, it is what it is. You know, we have to address that. But I think another interesting piece that we haven't really looked at is return on investment, right? So if we see healthier, happier parents and workers, right, who show up for themselves and their kids and not just for capitalism, what does that do for our very expensive systems, healthcare being the biggest?
Yeah, I think the other piece I'd throw out there that, as both of you were speaking, made me think of it is we haven't really thought a lot about prevention. And so when I think of it, I can't help but like I can't take my social work hat off. It's on forever. And when I look at sort of the child welfare system and the number of families that, and you could say the same thing for criminal justice, but I know child welfare far better. The majority of cases in the US that are substantiated where people lose their kids or are at risk of losing their kids is neglect. And neglect, by and large, is a symptom of poverty. It's very, very rare that it's actually intentional neglect, right? And so that's just one example. Is that we have built in these forms of inequality that we haven't really thought very imaginatively about. And so when I think about it, like I take a step back and think about it in terms of policy errors and history, right? We have not in any meaningful way adjusted the safety net or delivery mechanisms to match the market, right? So the last time we had a meaningful shift in the United States really was the 70s, when we think about a giant leap forward, and we are living through a moment of change right now. And so for me, when I look at it through that perspective, it's like I can jump in or I can just ignore it, but it's going to happen either way, right? Because every single time we have a meaningful shift either to the right or to the left in the safety net, it follows two things. One, an economic crisis with a protracted tail where people don't recover, and two, a period of civil unrest. And that's exactly where we are right now. And we are certainly in some form of late stage capitalism where, you know, eventually someone's going to write a book, A Brief History of Blank. What the blank is, I guess we all get to decide. We'll see who writes it first, right? But the point being, we're at a point of disruption where we are willing to interrogate not just the social contract, but epistemology and ontology in and of itself, right? And so that begs the question of, for those of us who sit in these positions of power, which I do, right? I'm not going to pretend I don't. I have a choice as to whose voice I'm going to prioritize. So when it comes down to sort of to what end, I don't know, right? For me, the end goal is really, like, first of all, justice and dignity, but second, that someone's voice has to be prioritized besides my own. So where that takes us, I don't know. What I will say is that the design that we came up with in Stockton, we would not have gotten there without the community. And so there's a lot I could say about that. I won't belabor the time to do so, but we consulted a lot of really brilliant people on how to build that RCT. And when we took it back to the community, they were like, y'all are dead wrong. This is not what we want. And then we adjusted it based on what they said, and we had much stronger data, right? So it's a lesson learned that we have to be willing to relinquish control. And that's terrifying, right? Because we just want to measure everything or stay in our box. So it's hard to say, but I mean, it's a tension that it's sort of like we're constantly living with, if I'm honest with myself.
That's good.
Yeah, sometimes, every once in a while, late on a Friday. So
I think it's super interesting as, you know, as this conversation, you know, starts to move towards the communities themselves and the recipients themselves. Something came up yesterday in the conversations with the Mayors for Guaranteed Income. They talked about how a huge part of the process for getting a demonstration up and running is actually building trust with the recipients. People don't believe it, like they think there's a catch. There's not, like, what does this really actually mean, and how long it can take for them to actually start to believe that it's going to come month after month, and for that shift of like of confidence that it's going to be there, so they can do longer term planning and things like that. And so I just love to understand a little bit more in the very short term, like what it means to be that these direct cash programs can do in building trust in their community and trust within the people that are administrating the pilots, and how to do that. But also, what's the larger impact on building people's trust with government, or with larger the larger picture that we think, you know, is an important part of this puzzle that I think is an important one for us to talk a little bit more about. So maybe starting first on the recipient side. And I feel like it's almost a little bit of like taps into some of what Sarah was saying at the beginning around that in Alaska, you don't call this a redistribution of wealth. There's something like, you know, like how, but this is just like what we're owed as kind of citizens of Alaska. And because that somehow is a different feeling about who it's coming from, and how, you know, and our relationship to these larger kind of entities and stuff. But maybe, I know I just went into a lot of different areas, but maybe starting specifically in you can see all the like different wiring as you guys are talking.
One thing I'd say about trust is I'd really point people to Seed's first year findings. We talk a lot about trust and the role of it in terms of implementation and also data collection. But it really begs a bigger question, which is that every single system in our society is telling people that they don't matter, right? And so if you're immersed in extractive capitalism and you're experiencing accumulated injustice, every dial is pointed at telling you that you're not to be trusted, right? And so when we think about these pilots, it's not just about whether or not we're reknitting that trust. And I mean, it's fascinating with sort of Ontario shutting early. We heard that over and over and over again in Stockton, when people wouldn't believe us that the money would be on the card. They'd say, I watched the news. I know what happened in Canada. Why should I believe you? And that's still coming up even in the new pilots, right? And so it's not just about, do you believe the money's going to hit your bank account? But when capitalism spits you out over and over and over again, if we expect people to try and engage with a safer system, they're not going to if that trust isn't rebuilt, right? So if we don't, like, let's say I come up with a beautiful community land trust and I'm going to resolve the issue of lack of affordable housing. If I don't first rebuild that tie with that human being who's been told from birth that like you and your community don't matter, it's sort of almost a moot point. And so that's sort of like a bigger conversation in terms of like where we go with it. But to me, it's not just the trust of extending cash to people. It's about who we're centering the conversation and why. And I don't know, actually, I'm sure Dr. Cowan has a perspective on this, thinking about Alaska, because it's so much bigger than like our narrow piece. So I'd be curious to see what you think.
So I have the good fortune that I don't have to spend an enormous amount of money on data collection, because Alaska has terrific data infrastructure. And maybe it's from that vantage point that, I mean, I think Dr. Forget, that you rightly pointed out that we are talking about prioritizing two different sets of questions. And my response to that, you know, that from skeptics and, you know, policymakers, and that from the populations that would be most affected. And my response is like, yep. Like, we can do that. We can have two priorities at once. The other thing I want to mention that I think is really valuable is that we're having pilots from lots of different communities. The legislators that I spoke to in Alaska I have to say, I was so impressed by them. And across the board, I felt like, they actually really want to represent and advocate for their community. And they didn't care anything about what happened in Stockton. Stockton was irrelevant to them. If anything, they were hostile to it because it was California, But me being able to say, I want, here are some things we found out about Alaskans, and we want to find out more. That was really important to them. And I also, look, I share your frustration at the mountain of social determinants of health, articles that prove the same thing over and over again. And there are times when I want to just throw my hands up and go for a hike, or binge Netflix or something and just give up. But then I think I guess we haven't convinced the right people. And so let's find out what is going to convince the people who we need to convince now, because this hasn't been it. And that means we have to find out what questions are most important to them.
Evelyn, yeah, hop in there.
I'm gonna play devil's advocate again here for a minute. When I think about the questions people have about basic income, many of them are questions that can't be answered with pilots. They worry about cost, and that you can't, how are we going to finance it? What's the cost of this? And that an experimental pilot is not a good way of estimating the cost of a program, and financing is a whole different set of questions outside of it. They worry about temporary changes, pilots, employment in particular. They worry about the difference between a temporary pilot and long-term behavioral changes associated with the shift in programs going forward. No pilot is going to convince people, no matter how often you show that people continue to work with the pilot, it's not going to convince the people who are convinced that that's not true. They're just not going to believe it. I think all of the community building is a really important thing. I think that this is a really worthwhile thing. And I think that's what excites me so much about the pilots, to be honest. But I'm not sure that I see it convincing people in a position to make changes in policy. I'm not sure that I see policy, and I'm being, my comments here are being colored by the political context in Canada. I don't see that policymakers are accepting the results that come out of the experiments. I don't see them accepting the kinds of arguments that are being made. I don't see them being convinced by it. And so I wonder to what extent it makes sense to spend a lot of money and a lot of time and a lot of resources replicating things when the results we're getting are exactly what we expected to get. We're seeing exactly what we expected to see. There are not a lot of new surprises there. We're just layering more and more and more results on top of what we already have. And everybody says, well, it's just not true. I don't buy it. Or it happened in California, so it doesn't matter for Alaska. Or, I don't know how to deal with that kind of frustration when we look at pilots. I just throw my hands up in despair at some point and say, how do we convince people? How do we convince people who don't buy into it? And I'm not sure that the kinds of stories that are very, very convincing to people who buy into the idea of UBI, when you're preaching to the choir, are going to convince the critics out there, are going to convince the skeptics.
So I think there are certainly people who will never be convinced, but I think that we've got a variety of messages, right? So one message, and for a lot of people, we can find the message that fits for them as long as we listen before we speak. I know people, so, I didn't come to this work because I was a UBI advocate. I'm not a UBI advocate. I'm a researcher, but I came to this work because of the analytic properties of the cash transfer in Alaska, but then, and so I feel like I'm well poised as a messenger in some sense, because I have a lot of skepticism. on a federal scale, this would be one of, if not the largest redistributions of resources in American history. I mean, that is extraordinary. And, I think we don't have enough evidence. I think to move forward in this moment with like a federal, tax financed basic income would be such a massive change on too thin evidence. That's why I'm spending my energies on doing this. And I think, like I said, I think there are people who are persuaded by autonomy. I think there are people who are persuaded by the fact that we, in the United States, and I can't speak to Canada, but there are millions of people who are eligible for benefits and don't get them because it's such a massive challenge to navigate these systems. I mean, the joke I say is like, if you've ever incurred a library fine, you would be a terrible poor person. Like,
I have to play devil's advocate back to Dr. Forte. I'm sorry. We have the child tax credit starting in July. That is a form of guaranteed income. I mean, yes, I'm with you. We're not going to convince everybody. I get that. But at the same time, we just ended the Trump era, right? Maybe it's not over, for lack of a better way of putting it, right? But we literally had cash payments at the most divisive point in US history. It's hard to imagine, I mean, maybe if I was alive during the Civil War, but like, come on, right? Is that we're talking about, we had cash payments passed under Trump and under Biden. Were they long enough? Were they enough? No, of course not, right? But we also had the child tax credit, right? And so to me, the fact that we're even having this conversation is extraordinary. And maybe it's just my optimism, like I have to get out of bed in the morning, so I'm going to stay optimistic, right? But at the same time, when I do look at the data and when I look at narrative shift, we are at a turning point, right? So like 3 years ago, neither of us are tenured yet. Stacia will hopefully be tenured in a week, right? But I sort of, when we started this 3 years ago, people said, don't do that. You're risking your tenure case. You're crazy. This is never going to work. And that's just me, right? I'm only here because of everybody else who's on the call, who's been doing this work for decades prior to my existence, right? But when I think about fast forward to the fact that right now we're having a public conversation in the US, at least, around cash payments, child tax credits, intersectionality, who's deserving and who's not, that's extraordinary. So to me, that's a massive shift. And so will it stay? I don't think so, right? Like that window's going to close. That's without question.
Yeah, that's what keeps me up at night.
Yeah, like we can't go fast enough. Right?
The momentum, and we have exactly like 3 years to.
Yeah. And so that's really, but the other thing that I worry about is sort of what, and I said this on a call, earlier today with someone, I forget who it was at this point, but what happens when white folks recover from the pandemic,
Mm-hmm.
right? Then how do we think about our framing around data? Because Black and brown communities are still going to be vulnerable because they're vulnerable forever, not because of the pandemic, like that pre-existed the pandemic, right? So it's kind of a hot mess of a lot of things, but at the same time, I do see tremendous willingness to have a national conversation about deservedness. And some of that comes, it's not the role of researchers, it's because communities are holding those in power accountable in new ways. So like, it's not just because we're researchers and we have really great momentum around cash. That's not it, right? That opening's been created because people are agitating for justice in new ways. How it's connected, I can't prove that empirically. I'm sure somebody will yell at me afterwards on Twitter because I can't prove what I just said. But right, at the same time, it's not an accident that we have a disruption in social upheaval at the same time that we have a resurgence in conversations about deservedness and cash. It can't be an accident. It's not possible, at least to me.
Well, and
I agree with you. If I could just, I agree with you absolutely. What I don't see is the link back to pilots and evidence. I think that these changes are happening, and they're happening. If changes happen, they happen for other reasons that don't really have very much to do with evidence that's collected.
Yeah,
that's the link I'm missing.
Mm-hmm.
I don't know the extent to which the data we collect actually convinces people to make changes. Changes sometimes happen, but they don't necessarily happen because we present data. And I think, I don't know, maybe we play into it, maybe we don't.
It's hard to say. I mean, I will say though, I think when we're seeing things like cities put up millions of dollars in public funds. I don't think, I mean, I would say I'm biased, right? But like, I can't imagine Mayor Garcetti 5 years, like a Mayor Garcetti 5 years ago saying, I'm going to appropriate the millions of dollars, public money. That comes from something, you know, I mean, who knows? It's impossible to say, you know, I don't know.
Well, and I think I'm going to take off my facilitator hat for a minute and put on my grassroots and coalition building, like, or as an organization hat, and say that, and maybe just kind of echo or bring back something that Evelyn said, I think a couple of times ago, which was how exciting and interested she is in this idea of community engagement. And I think that there's something really interesting that happens when you couple pilots with community engagement, and intentionally and strategically. And I think that what we're really talking about is not thinking about things in silos, not thinking about grassroots is about policy only, you know, but really just about like, how do we, and for some of the things that I think are most exciting and interesting that are part of what's happening right now, Mayors for a Guaranteed Income is an opportunity for communities to get excited about an idea or dig deeper in there. How do we leverage that into opportunities for people to feel empowered to take action, for something to be larger, right? And I think that that's a piece that is really important and really critical as we move forward, is how do we make sure that policy, you know, pilots, thought leadership, and grassroots are together when a lot of this is happening, to help make sure that those opportunities aren't missed, to be able to have that wider impact, have that and longer term impact, so that when this little moment that we find ourselves in with the doors starting to open, that there's enough bodies there to get in the middle of it and force it to stay open, right? Like, and it is, when it comes to like the child tax credit and some of these other pieces, it is an opportunity for a lot of people to start to realize, to have some skin in the game of making this permanent, making these things happen, right? It's suddenly this much larger community of people that potentially might start to make this a priority and make sure that their voices around this are heard. So I just wanted to put that in there. We're coming up at the top of our 90 minutes together, but I just love that this is gotten to really, you know, I mean, it's the theme of this conference, is bringing together activism, policy, and kind of thought leadership, and thinking about how does this work together, versus staying in siloed kind of places and not being able to grow the movement. All the pieces are in place. The movement is growing, but it might not seem like a movement yet because it's a little bit here and there and everywhere. Like, let's bring it together to be a movement. And so I'm really glad, Evelyn, that you kind of brought some of that to the surface, for sure.
We weren't able to get to the Q&A from,
I integrated a few things that Keiko asked about community engagement, and
okay,
we're going through. Yeah,
I was gonna say that I for one can stay on a little later or longer. I'm not sure about others.
I'm happy to stay on a little bit longer. We also have Kumo Space, which is what I was just about to say, which is a kind of more casual networking place where you can go and there's rooms and you can have conversations. And we love to invite panelists who do have a little bit more time to go there, and audience members who want to be able to engage in that. It's actually a very fun, kind of cool experience. You get to move around, and your mic picks up as you get closer to people. You can start to hear the conversation, and if you want to join, you can join. It's a little bit more of it mirrors more closely like if you're an actual physical conference and kind of surveying a large ballroom and thinking like, where do I want to go? So we would love to have this conversation continue, and there's actually I think a room in there called pilots, or kind of like data-driven conversations and things like that. So that would be fantastic. And I think it's getting dropped. I can see right now the link to Kumo Space getting dropped in the chat. So that would be fantastic. We had a blast yesterday after the keynotes, a bunch of us in there having conversations. thank you for being
You
open
can
to
stay on, but
Yeah.
please do feel free to reach out to us on email, anybody who has questions. Stacy, thank you so much for some brilliant facilitation, and to Dr. Forget and Dr. Cowan, seriously.
And Adam, don't forget
And
Adam.
I know we can't forget, he's not here anymore, he can't hear me. We are such fangirls of both of you. Thank you so much for your work.
The feeling is mutual.
Absolutely.
Well, thank you.
Thank
I
you.
think this is, yeah, I'm gonna ditto all of that. This is one of the conversations I've been most looking forward to over the last months as we've been pulling this together, and to have you all here together has just been fantastic. So we so appreciate you guys, the work that you're doing, the leadership, the thought leadership, and the kind of honesty and that you bring to the work, because I think that just shone through this entire, conversation. So really appreciate you all, and we appreciate the audience that's out there that's been engaged in this. I didn't do official questions, but we actually got to at least 20 to 40% of the questions that were in there. A lot went in because it was such a